For some questions on the exam, the NBRC loves to include a lot of details, and it's up to you to break it all down in order to determine the correct answer. In this video, we're going to take you through one of those questions, which involves looking at the patient's signs and symptoms in order to figure out what's going on. So, if you're ready, let's get into the question. During the assessment of a 64-year-old female patient, you note the following signs: dyspnea, hypotension, and a tracheal shift to the right. The patient has absent breath sounds, reduced chest expansion, and a hyperresonant percussion note, all on the left side. These findings suggest which of the following? A. Pleural effusion on the left side. B. Pneumothorax on the left side. C. Atelectasis on the left side. Or D. Consolidation on the left side. To get this one correct, you needed to interpret all information provided in the question. This is a common question format that you'll see on the TMC exam. The question states that the patient has reduced chest expansion, a hyperresonant percussion note, and absent breath sounds on the left side. It also points out a tracheal shift to the right. All of these suggest that the patient has a pneumothorax on the left side, because remember, the trachea will shift away from the affected side when a pneumothorax is present. Therefore, you can rule out left-sided atelectasis because if that were the case, the trachea would shift to that side. Pleural effusion and consolidation would cause a dull percussion note, not a hyperresonant percussion note. So we can also rule out those two as well. Therefore, by reading the question carefully and breaking down all the details that were provided, we could determine that the correct answer is B, pneumothorax on the left side. If you enjoy practice questions like this, definitely consider checking out our TMC test bank. It's a massive bank of practice questions with helpful explanations like this one that students are using to pass the TMC exam. It also comes with 4+ sample TMC practice exams to help you test your knowledge and prepare for the real thing. If you're interested, I'll drop a link below this video if you want to learn more, including some helpful premium bonuses that are only included for a limited time. But if you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always, breathe easy, my friend.